The UK government have just announced and confirmed a £100 billion project called Operation Moonshot, with the intention of getting 10 million people a day tested for COVID-19 by 2021. This is probably one of the most frightening things I have ever heard in my entire life, and this is one of the most important videos I think I've ever made, and I'd love to explain to you more about Operation Moonshot. So if you go to the British Medical Journal, you go to their website, there have been 2 reports posted today of a leaked document from the UK government, intentionally leaked to the British Medical Journal, and people have been writing their analysis of what they have shared. So I'm going to share that analysis with you right now. I'm going to explain to you what it means, and then we'll talk about the impacts that this could have on our planet, on our most vulnerable people, especially on our elderly. COVID-19 has changed our planet forever. I think everyone can agree that everything has shifted. We have had to adapt our businesses, we've had to adapt our medical system, we've had to adapt the way we interact with our families. And we understood that this was to save lives. We understood that this was to stop the spread. And initially when we were asked to lock down, it was for a few weeks to help flatten the curve. Since then, there have been ongoing extra restrictions around the lockdown put in place. And this today, I'm just going to share with you now. I have my documents here, so I'm going to read this to you. The government are investing over 100 billion in this program. And this is to build huge testing centres, warehouses and infrastructure. This level of investment, £100 billion, is basically the entire budget for the NHS in England. The entire budget for the NHS is around 120 million. This is 120 billion. This is 100 billion. So starting from next month, the government have a plan to get us up to 800,000 tests per day. So just to give you some context, currently today, right now, on the 17th of September 2020, we do around 200,000 tests a day. Out of those 200,000 tests, around 3,000 come back as positive. So the tests that the government are using right now is called the PCR test. So by next month, they're looking to get this up to 800,000, so 4 times as many. When you look at these 800,000, that might make sense, okay? So if people have symptoms, we would test them and then we can deal with them. I can understand that. But when they outline in this memo what the details are, 200,000 of those 800,000 tests will be for people with symptoms every day. 250,000 of these tests will be for people in care homes and hospitals, and it says explicitly that show no symptoms. So these are people who are perfectly healthy, there's nothing wrong with them, and we will be giving them these COVID swab tests up the nose. If you've seen it, goes quite far into the nose. It's quite uncomfortable. I know I haven't had it done personally, but I know many people who have. They said it's quite uncomfortable, quite painful, and this will be happening every day. Every day. So for our most vulnerable people, for our elderly people who are in care homes, who are in hospitals, they will get tested every single day. A lot of these people, they're not able to make decisions for themselves. They can't stand up for themselves. They might have dementia or something along those lines. This is an invasive procedure, but it's not even about that. There is something with the PCR tests called false positive results. So the BBC, they just did a whole piece on this. You can go check it out on the BBC website. They basically called the PCR tests flawed. They said it's a flawed test. It gives a high number of false positives. So what does that mean? That means that people who are perfectly healthy, who do not have any COVID-19 in their systems, they get a positive test result. And it's a reasonable percentage. So let's think about that for a moment. If we are going to be working up to, by 2021, 10 million people a day being tested, Let's even just say that 1% are false positives. It's actually much higher than that. That means out of 10 million tests, that would be 100,000 people every day who would get told they had COVID-19, that they were contagious when they weren't. So those people then have to quarantine, they can't go to work, they can't go to school, they can't see their family. This is quite serious. We know these tests are flawed, and there is a big investment by the government right now to make better tests. So that is happening, but that technology doesn't exist right now. I literally had a call with a hospital today. I have a 2-month-old daughter. I refused to let her have the COVID swab test because her nostrils are so tiny, and several babies have actually died from having this COVID swab test. So I refused to let her have it. So I've been speaking with PALS, which is a board that helps patients and speak to hospitals on their behalf and like come to an agreement. So literally today, the hospital told me there is no other test that we can do, but that is in development, but it doesn't exist right now. So we have to assume they're going to go forward with the PCR tests with the high false positive rate. Now, what happens in a care home right now when someone has a positive COVID result? That person is isolated. They're put in a ward, an isolation room with actual sick people. So you're taking a healthy person, you're putting them in a room with a sick person. Now, if every person in every care home is being swabbed every day, how many false positives do you think you're going to get in a week? It's going to be astronomical. We're going to be literally locking away perfectly healthy, elderly, vulnerable people with sick people. And the government know this, and it's classed as collateral damage. It's classed as okay in order to stop the spread of this COVID-19, supposedly. I say supposedly because it's pretty clear to me as a researcher, someone who's been studying this for a long time and who has made many videos and written many posts about this. There's a different agenda here. This 100 billion, the government have already started signing what they're calling letters of comfort with certain companies. So they're already giving certain companies agreements to make millions of tests per day. So this is insane, right? There's another project that the government are working on right now called HS2. It's a high-speed railway. They've done the same thing. Again, that's a £100 billion project. Most of that money goes to consulting companies, and the government work with these consulting companies. Now, there is a genuine concern right here. This is not from myself, but I do echo what this says. This is from the Professor and Chair of Global Public Health at the University of Edinburgh. They're called Devi Sridhar. It says, I have concerns around the bidding process for these contracts. The procurement process isn't clear, and it allows for a lot of people getting rich off this crisis. This is public money that we're going to have to pay back at some point. Governments make huge amounts of money from war. They also make huge amounts of money from disease. The pharmaceutical industry make massive amounts of money from disease. And we all know that money is a big motivator for some people. We know that politicians can be easily bought. We know that scientists can be easily bought. But it's pretty clear to me now, looking at this from as an impartial perspective as possible. I am passionate, but I'm also very scientific. I look at things from both sides. This isn't about people anymore. This is about profits. In the UK, over the last 7 days, so from the 10th of September to the 17th of September, there have been 83 deaths. 83 deaths where someone has had a positive coronavirus test. Now, the UK government are open now. They say 83 deaths that have had a positive coronavirus test within the last 28 days. We don't know what those 83 people died of. But if they had a positive test within 28 days, the government are counting them as a coronavirus death. Now, this is dangerous because they're testing these people, elderly people in care homes. Like, if they test an elderly person, what are the chances someone's going to die within 28 days? I think there's a good chance. They're testing people in hospitals. What are the chances that there are going to be people who die? Like, how many of those 83 actually died from COVID-19? We don't know, and we can't know. But spending 100 billion, like, imagine if they invested that 100 billion into the NHS, into the National Health Service, what good they could do. That would be doubling the budget, right? We could actually pay nurses well. We could give people real treatment, help make them healthy instead of just keeping them alive and giving them medications, which is what a lot of the National Health Service is. There's some other things we need to think about. Let me know how you feel about this already, by the way. So the government plan is to have 10 million tests per day by 2021. So that looks like, and Boris Johnson has said this openly, every person every day getting a test, essentially. So in the morning, you do your COVID test. Before you go to work, you get the results back within 30 minutes. This is the plan. This technology doesn't exist right now, but they're going to make this. You'll get your result within 30 minutes. If you have a positive result, you are not allowed to go to work. You're not allowed to go to school. If you're a child, you're not allowed to go visit your family or friends. You will have to isolate. You will have a digital, this is in the report, this is in the memo, you will have a digital passport that shows what your last test result was. And if you want to go to any kind of venue, event, restaurant, you will have to show your digital passport. What that might look like, an app, it might look like a microchip. We don't really know at this point, but a digital passport is what they're calling it. That will get read and it will show your latest result from that day. Can you imagine? Can you imagine? And you don't know if it's a false positive or not. So let's say you go to work 300 days in a year and there's a 1% false positive rate, but it's actually more, right? That would be, out of every 300 days, you'd get 3 false positives. So 3 times you would get told you had COVID, you'd have to isolate for 14 days, even if you don't. And now there might be some ways we can get you to do another test, but this is what's going to happen. It's absolutely insane. And this is all laid out. You can go to the British Medical Journal, you can see all of this. I'll share the links below for everyone as well. But there's a professor of biostatistics at the University of Birmingham. He's called John Deeks. And here's what he says. He says, I'm horrified that the plans, so this is the memo, the Operation Moonshot, I'm horrified that the plans are devoid of any contribution from scientists, clinicians, and public health and testing and screening experts. These are plans from the world of management consultants and show complete ignorance of many essential basic principles of testing, public health, and screening. So he's effectively saying that this is management consultants. So this is consulting companies, similar to what they did with HS2. They've paid these consulting companies billions of pounds to come up with all of these models and theories, but they're not consulting scientists, they're not consulting clinicians and actual experts. He goes on to say, the author appears totally oblivious to the harms that universal screening can create. This is frankly dangerous. And then Deeks went on to say, mass testing could throw up enormous numbers of false positive results. And here's his example. He says, even if you have a test which is 99% specific, so this is the professor of biostatistics, okay, at the University of Birmingham. This person knows what they're talking about. Even if you have a test which is 99% specific, so only 1% of uninfected people will get a false positive result, if you then test 60 million people, we'll be classifying a group the size of the population of Sheffield as wrongly having COVID every day. This will cause substantial economic harm and a massive need for further testing. I'm basically saying that our government is not fit for purpose right now. They're not acting in the best interests of the British public. And it's pretty clear to see that. There are other countries in the world that are even more harsh than the UK. So if you look at Australia, particularly around Victoria, so where Melbourne is, they recently filed a vote of no confidence in their leader, Daniel Andrews. A vote of no confidence is basically saying that you don't trust the government to take care of you anymore and that they need to step down. I'm usually such an optimistic person, and I really believe that this is an opportunity for us to change the world for the better, for us to get rid of these corrupt people that are clearly paid off, that are clearly care more about profit than people, and to put great leaders in their place. But if you have been quiet, if you have been skeptical, if you have been sat on the fence until now, you must stand up. You must protect these elderly people, these vulnerable people, and share this with your family, share this with your friends, share this with people who look after elderly and vulnerable people. This Saturday in London, there is a huge rally of medical professionals. So it's all doctors, nurses, people from various different medical fields. They're coming together to basically tell the government the truth about this whole COVID-19 situation. Most of these people who stood up and gone against the mainstream narrative, they've been made redundant, they've been ostracized, they've lost their funding for their projects, and it takes a brave, courageous person to stand up against corruption, but that is where we're at. I'm going to read another piece now. This is, again, from the same document. This is from Martin McKee, who's the Professor of European Public Health at the London School of Hygiene and Tropical Medicine. So the Professor of European Public Health. He says, this plan bores the hallmark of a government whose ambition far exceeds its ability to deliver. He said the plan transmits unbounded optimism, disregarding the enormous problems with the existing testing and tracing programs. Worse, it envisages a major role for Deloitte, a company that has presided over many of these problems. It focuses on only one part of the problem, which is testing, and says nothing about what will happen to those found positive, a particular concern given the low proportion of those who do adhere to advice to isolate, in part because of the lack of support they are offered. What parliamentary scrutiny will there be of a programme that would cost almost as much as the annual budget for the NHS in England? So the government roll out this plan, 100 billion. They're already paying billions to their friends, to their consultants, to these companies who are creating this PPE and the vaccines and all that, everything else. So they're already sending these billions out to people to do more testing, to create testing centres and quarantine centres and everything like that. This is already happening, but there's a big chance that the project will never actually work because the technology doesn't even exist. It's very ambitious and we don't even know if it will help. And this is exactly what they've done with the HS2 project. The HS2 project's been going on for years now. Billions and billions and billions spent just on consulting, and we do not know if it will ever be completed, and many people do not even want it to be completed. There's huge resistance in the UK to having this HS2 project completed, and I'm sure there will be huge resistance to having this £100 billion testing programme implemented, which will leave our elderly and vulnerable people in a very precarious position. But it will also leave you in a precarious position. You do not know every single day when you do that test in the morning if you'll be positive or not. You have no idea. And it also says in this article that the new tests that they're bringing in, because they are new, will probably even be less accurate than the PCR tests, which is already in the BBC saying that it's flawed and very inaccurate. So the new tests will be even more inaccurate. I don't know what kind of false positive rate it might be. It might be 1%, it might be 5%, it might be more. I really believe that we must do something about this. For the sake of my daughter, for the sake of my family and my friends and my loved ones, and if you're feeling passionate about this too, please educate yourself on this. I'll post some links below. The people have the power. The government is here to serve the people, and they're not serving the people. It's very clear to see they're serving their own profits. It's time for us to stand up. There's so many local groups you can join where people have been talking about this for a long, long time. Get connected, speak to your local MPs, speak to your leaders, put pressure on your leaders to do the right thing. And I think when this becomes public, this just came out today, but I think when this becomes public, most people will know deep in their hearts this is not the right thing to do, and we need to get this government to step down. So I'm bringing you this today. I'm shining light on this whole situation. I'd love to know your thoughts. I'd love to know your feelings. Thank you if you are one of those people who really cares. Thank you if you're one of the people who shares. Thank you if you are helping to spread this message, because if we stay quiet, if we acquiesce, they're just going to keep taking more and more and more liberties. Look at what's happening in Australia right now. Just today in the UK, they announced that there was a curfew being implemented in the northeast of England. So that's over 2 million people now have a curfew, and they're not allowed to be mixing with any other people after 10 p.m. One of my friends lives in Melbourne. They've been telling me a lot about it. They've had that curfew for 8 weeks now. It's not going away. That's why they're doing a vote of no confidence. The government are rolling out this curfew in the northeast now. It's only a matter of time till it's the whole of the UK. Once you put these measures in place, can you imagine, once you have invested 100 billion in this infrastructure, these testing centres, these warehouses, these companies have ramped up their production. They have to do something with all of those tests. So this will not be going away if this gets implemented. So we have to stop it right now. Get them to invest all of that money, the 100 billion, in helping people be healthy, and see how fast our world changes. Thank you.